If you've suffered a tibial spine fracture, or more likely one of your kids did, what is it and how can you get over it? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. The tibial spine is where the ACL attaches to the top of your shin bone. So I don't know how well you can see this here, but the ACL, big thick ligament in the center of your knee, attaches to a small bony prominence in your knee at the top of your shin bone, and that's called your tibial spine. Now, in high school age kids, typically, certainly college and adults, almost all the time the ACL tears in the middle of the ligament, or maybe it pulls off the bone on one or the other side, but it's typically a ligament injury. But in younger kids, the ligament may hold intact, but it pulls the piece of bone off the top of the shin bone, off the tibia. And so it's like an ACL, but it's not exactly like an ACL. So in this case, the treatment options are a little different. We've talked about ACL injuries, how so often you end up needing surgery to make a new ACL. That's typically not needed here. A lot of times what you can do, well, in cases where the tibial spine is sort of pulled off, but it's still sitting in the right place, sometimes it doesn't even need surgery. Sometimes it can be putting the athlete in a brace, maybe make them non-weight bearing for 3 weeks, 4 weeks, 6 weeks, whatever it takes to heal, and they may do well. But sometimes that tibial spine pulls way off the top of the shin bone and a surgeon has to go in and reattach it. We can usually do that through the scope, through a few little poke holes, and you pass needles and stitches through it and then maybe pull that tibial spine back down onto the top of the tibia through tunnels that you drill in the tibia to anchor it down. And that can do very well. Has good healing rates, still a long recovery, still looking at 3, maybe 4 months, a little bit better than an ACL for sure, but still a long recovery. And it has good success rates, again, in these young athletes. So if you go and watch some of the videos on the recovery and the rehab for ACL surgery, a lot of this is the same. But again, it's a little different variation. And again, probably something that you would want to fix early on if at all possible. So again, if your child has a serious knee injury and knee swells up really big, struggles to put weight on it, go see a sports medicine doctor, get x-rays, potentially even getting an MRI potentially to find out exactly what the nature of the injury is and then decide what the best course of treatment is so that he or she can get back to sports sometime in the relatively near future. If this video is helpful, click the link below for many more helpful videos on sports and exercise injuries. Make sure to subscribe, and I look forward to seeing you next time.